In this video, I'm going to show you 5 gentle moves to release that stuck feeling in your lower back and hips. You may even begin to notice some relief within minutes of doing these exercises. Let's get started. Hi, I'm Dr. Cordova, a chiropractor here in Houston, Texas. Let me ask you, have you tried back exercises before only to find that they made your pain worse or felt very difficult to do? That's one of the most common things I hear from patients, and it's exactly why I created this video. Most exercise videos are simply too aggressive for a person that is already in pain, and pushing through them is one of the worst things that you can do. In a moment, I will demonstrate my exercise routine. Follow along because each movement in this routine is designed to target your lower back, sacroiliac joints, and hips in a way that is gentle, manageable, and safe. I have given these exercises to thousands of patients who felt stuck with their back and hip pain, and many have experienced meaningful relief within minutes. Be sure to follow the exercises in the order I show you because they are designed to flow and build on each other. Always move within your comfort level and never push through the pain. And make sure you stay to the end because I have a 6th bonus exercise. This exercise is specifically designed for people who sit for long periods, and it may be the single most effective thing you can do to relieve that persistent lower back and sacroiliac pain. We're going to start with supine pelvic tilts. We are starting here because this is one of the safest ways to gently begin releasing tension in your lower back, sacroiliac joints, and hips. My patients often tell me they love how simple and relieving this feels, especially when the back is sensitive. It helps them feel more in control again, and it's usually the first movement where they notice things starting to loosen up without triggering more pain. Okay, we're going to do supine pelvic tilts. This is a very subtle movement, and so all we're trying to do is get our pelvis to kind of go back and forth that way. It may be a little tricky at first. These may not be muscles that you've used very often, and so that's why we're doing them. So you're going to lay on your back. You can do this in your bed. You can do this on the floor. I usually just recommend doing it on the floor. And all we're trying to do is get our pelvis to twist back and forth. So it's a very subtle movement. You'll feel in your abs that pelvis is going back and forth like this. I want to do about 10 of these movements. You should start to feel this in your lower back. I'm going to do 10. You're going to rest. Count to 10, count to 20. We're going to do 10 more. I do recommend that all of these exercises that we're talking about today, you're going to do 3 sets of 10. All right. So you should feel that in there and in your lower back. Almost feels like you're pushing your lower back into the ground and then you're lifting up your lower back. Pushing your lower back into the ground and then you're lifting up that lower back. Very subtle movement. All right. That's the supine pelvic tilt. The next exercise is knee hugs. This is where we start to gently open up the lower back, sacroiliac joints, and hips a bit more. My patients often tell me they really like this one because it feels more targeted, especially on the side that feels tighter. It gives them the sense of a deeper stretch without strain, and many say this is where they start to notice a more clear release in those stiff, stuck areas. Okay, these are knee hugs. And so we're also gonna lay on our back here, and all you're doing is pulling your knee to your chest as best you can. A long, slow, sustained movement. We're going to give that a good count to 10, and then we'll relax it. Now you can do the same side or do the other side, and this one's going to do the other side. Again, count to 10. The longer you can hold these, the better it's going to be for you, but we do want to stay where it's comfortable. Ideally, you're feeling it all like right in here, maybe down into your butt area, your hip rotators a bit, but you're just doing a slow, gentle pull. We're going to do each side 3 times, counting to 10 each time. Again, sometimes I have patients that do this before they get out of bed in the morning because this is really what loosens up their back. Okay, those are knee hugs. And do watch to the end of this video because you do not want to miss the bonus exercise. It is a simple seated movement that helps relieve lower back pain and reduce soreness in the sacroiliac area, especially if you sit for long periods. Keep watching. Next is the supine figure 4 stretch. This is where we start to target the hips more directly while still releasing tension through the lower back and sacroiliac joints. My patients often tell me they love how this exercise gets them into those deeper, harder to reach areas. It gives them a strong but comfortable stretch. Many patients say this is where they feel a noticeable release in their hip tightness that has been lingering with them for a long time. This is the supine figure 4 stretch. Now this one, it can be a little tricky. You are going to cross your leg over here. Now a lot of people think it's about pushing here, and it's not. We're really trying to get into this area to stretch. So we're going to reach through our leg and grab the leg that is otherwise straight, not bent over, and you're going to slowly pull that towards your chest as well. You're going to feel all of that like right through here is a bit deeper. Again, we're going to count to 10. And then we can do the other side. Same thing. Again, it's not about trying to push this down. You're going to reach through to the leg that's not crossed over and slowly pull that to you. We just want a good count to 10. And relax. So each leg, do that 3 times, count to 10, and then you're done. The next exercise is the supine spinal twist. This is where they begin to gently introduce rotation, which helps release tension through the lower back, sacroiliac joints, and into the hips in a different way. My patients tell me that this one feels very relieving, especially when their back feels stiff or locked up. It gives a sense of loosening across the entire area, and many say it helps them move more freely afterward. All right, this is your supine spinal twist. So supine just means we're laying on our back. I'm just going to take both knees and twist to one side. Now, if you want to stretch out this upper area, you can also open up here, but you don't have to. Since we're focused on the lower back right now, we're just going to do this. If your legs don't hit the ground, that's okay. It's more about just getting as much of a stretch as you can. You don't have to overexert yourself. You just want to feel that it's stretching and it's twisting. So we're going to do a count to 10. Okay, and here, then we're just going to go right to the other side. 6, 7, 8, 9, and 10. So do each side 3 times, count to 10 each time, and you're done. Next is the glute bridge. This is where we shift from stretching into gentle strengthening to help stabilize everything you just released. My patients often tell me they like this one because it makes their back feel more supported, and many say it helps the relief last longer. Okay, this is the glute bridge. Now you'll see that I put this exercise in a lot of stuff because I think our glutes are very helpful in strengthening those to hold and support the lower back. This is something, especially for people who sit a lot, that their glute muscles get weak, their hip rotators get overactive. And so that's why you'll see that we're stretching hip rotators and we want to strengthen glutes. So here is the glute bridge. Really, you just want to lift up. You really want to concentrate on squeezing the butt. You're going to hold that for a count of 10. Then come back down again. Hold up again. You might find this is super challenging at first, but it really should not be after a while. The glute muscles should be strong after a while. If you can't hold it to 10, then hold it as long as you can. If you start to feel burning or anything, then just let it go. And then we're just going to keep doing these. This is one of those that you can probably just do 1 set of 10, especially if we're going to hold it for a count of 10. That could take up a lot of time. If this is way too easy for you, you can make it challenging by doing 1 side at a time. And so you're just holding that up, especially if you have issues and weakness on one side, but you don't have to. And then same thing, we're just going to hold it. You really just want to concentrate on squeezing the butt and making sure that everything's up, and count to 10 each time, and do 1 set of 10, holding it for a 10 count every single time you come up. That's the glute bridge. Now here's your bonus exercise, the seated spinal wave. This move is especially helpful if you sit for long periods because that is when the lower back tightens up again and sacroiliac joints tend to get aggravated. My patients often tell me they love how easily this is to do during the day and how it quickly relieves that buildup of stiffness and soreness in the lower back and hips. All right, so this is the seated spinal wave. Now you probably have heard of cat-cow exercises, and that's one where you're on all fours and you're really bringing your belly up and you're really bringing it back. That's basically what we're doing here, except we're gonna do it seated. So I like this because during the day, there's sometimes limited areas for you to stretch. Maybe you don't have a private office and it's just something that's going to be really challenging for you to do. So instead, what you're going to do is just get to the edge of your chair. Of course, I'm wearing black and this chair is black, so it's not as easy. But you're basically doing this and then coming back up. So you're rounding that lower back and then really extending that lower back, rounding it as well, and extending each time. So you can do this more subtle if you need to, but this is really the idea is we're just trying to get some blood flow pumping between those vertebrae into those discs. And we really want to just make sure that we're over exaggerating that motion. So we want to do 10 of these. So there and back is 1. I have some patients that do this a couple of times a day. So they just set an alarm, do it in the morning, do it after lunch, do it even at the end of the day when they're doing their exercises. And of course I did not count. So I believe this was 9 and then 10. So we want to do 10 of these, do 3 sets, take a little break, do it again. All of these exercises are going to be more challenging at first when you're not used to them. But as you get stronger, that's one of the things you'll start to notice is that things are looser, you're moving better. And so we'll be able to keep getting this movement back and forth easier and easier. All right, that's a seated spinal wave. You now have a total of 6 exercises that are designed to gently release tension and improve movement in your lower back, sacroiliac joints, and hips. You can use this routine anytime you need to release that stuck feeling in your lower back, SI joints, and hips. Try them out. Let me know in the comments which exercise gave you the most relief. Was it the supine pelvic tilt or the seated spinal wave? Drop a comment and let me know. If you got value from this video, like and share it so others who feel stuck with back and hip pain can find something that actually helps. Remember to subscribe if you want to learn how to take care of your spine, prevent flare-ups, and stay pain-free with clear, actionable tips that you can use right away. Now, if you're also dealing with leg pain, the next video you should watch is this one, where I show you 5 moves to calm burning leg pain fast. Go watch this video next.